Hello and welcome. I'm Dr. Raj Iyer, a real practicing anesthesia doctor tuning in from New Jersey in USA. And this is our live session and Ask the Expert. This is one-stop shop for all information related to your health for you and your family. Do you know there are so many problems with COVID? The hair and skin are not spared. I myself could not believe when I saw some pictures of hair loss with COVID. You just put a gentle traction on your hair and you see a bunch of hair on your hands. This was so scary. I have pictures from real patients to show you later in the video, so keep watching till the end to see what can happen with this pandemic on the hair and skin and what you can do so you don't go through the same problems. So today I'm very honored to have Dr. Girish. Let's welcome Dr. Girish.
Hi,
Welcome,
Dr.
Girish.
Raj. Hi, Dr. Raj. Thank you so much for inviting me to be a part of your program here. I am very much honored to meet my friend after a long gap of more than 2 decades, almost 21 years. Nice. Yeah,
Well, I have to thank you for being here. So,
it's my pleasure. Yeah.
so Dr. Girish, who is so humble, is actually a chief of dermatology at a big hospital network called Employee State Insurance, or ESI in short, in India. Employee State Insurance is a self-financing social security and health insurance scheme for Indian workers with a huge operating budget of $11 billion as of 2021. In this weekend, Ask the Expert series, we have expert doctors from around the world who volunteer to take their time and come to this platform to educate you all. No matter what part of the world you're in, we want you to be happy and healthy. There are so many fake news out there on social media, WhatsApp forward, and so many other things. Here in our channel, you will hear from real medical doctors who are very experienced, and we provide information based on what is scientifically tested by doctors or based on their experience or both. If you are a returning viewer, you can check our other videos in the Expert series by clicking this link above. I want to welcome both the live and returning viewers. If you're a returning viewer watching the replay, remember this is a long video because we tend to cover many important things. You can always scroll to topics that are important to you in the video or by looking in the description below. If you are interested in learning about other topics, do leave it in the comment section below. If you find value in content like this, do smash the like and share button. If this type of content provides value to you and you're still not subscribed, I encourage you to subscribe to the channel so you get an update about new videos. In every live session, I share exciting things about our experts. So today, number one, Dr. Girish and me went to the same medical school or medical college, Bangalore Medical College, where we are alumni of. And number two, Dr. Girish is a celebrity doctor who is frequent on TV channels. If you watch the Southern Indian channels or particularly the Kannada channels, you may recognize Dr. Girish as he has been in more than 50 different shows. I have to thank Dr. Girish sincerely for taking his time out of his busy schedule. His clinical practice is so busy, he alone sees up to 70 patients on an average every day and more than 100 patients on a busy day. I'm just going to quickly show a disclaimer, and you can always look at this disclaimer in the description below.
Really, please. Please.
I want to remind you to post your questions in the comments below, and also if you would like to join live, just use the link in the comment section and you can join us by using any device, including a phone. Without further ado, let's get to Dr. Girish.
Yeah, thank you so much, Dr. Raj, for your kind words of introduction.
So, Dr. Girish, I have to bring up this picture which really shocked me that you showed. Also, I have to thank all our patients who have given
Yeah,
permission to Dr. Girish to share their pictures.
yeah,
Thank you so much.
yeah,
So, this was so
yeah.
shocking. You know, you just pull a strand of hair and looks like this is surprisingly real. How many people with COVID get affected by something like this?
Yeah, yeah, Dr. Raj. Actually, whatever I am seeing now, most of the, like I would like to say around more than 75% of the patients post COVID are experiencing hair loss. That too, 2 to 3 months after the COVID infection. That is to say, whoever had got like COVID in the April, I am seeing hair loss now in July. I think uh, this condition, what we call as telogen effluvium.
Mm-hmm.
To make it simple, hair grows in three cycles: anagen, catagen, and telogen phase. Anagen is growing phase, telogen is resting, and catagen is transition phase. At any point of time, if you take around 80 to 85% of the hair will be in growing phase, around 10 to 15% in the resting phase, and 5% in the transition phase. So, when there is an acute stressful event or an illness like COVID, what happens? This ratio gets reversed. Like more of the anagen rays or growing hairs will be pushed into the resting phase. So gradually they will get shedded up. So there is a lag, time lag in this. Usually anagen phase will be around approximately 1000 days. Telogen phase will be 100 days. Catagen phase will be 10 days. So anagen phase is 3 years. Telogen phase is around 3 months, approximately if you take. So what happens after 2 to 3 months after this illness, patient's hair will go to the resting phase. Gradually, it will go on shedding. This we call it telogen effluvium. So whatever patients had got infected in April, we are experiencing the hair loss in this June, July. This is happening. I think almost 75% of the COVID patients, what I am seeing, they're experiencing hair loss of this kind. It's a major chunk.
Wow, that is unbelievably high. And it's
Yeah,
also
yeah,
scary. You know, a lot
yeah,
of people have hair loss when they grow older, which is called androgenic
yeah,
alopecia,
yeah,
commonly seen in men and some women.
yeah,
How is
yeah,
this COVID hair loss different from androgenic alopecia?
yeah. That's a good question. In androgenetic alopecia, you see hair loss primarily in the crown, or what you call bitemporal recession, in the sides of the hair and in this area. Whereas in COVID related hair loss, you get diffuse alopecia. Hair loss will be throughout the scalp, not in any particular frontal area or crown. Hair loss will be throughout. In androgenetic alopecia, what we call initially there is miniaturization of hair follicle. The thick hair will become thinner and less color. Gradually, it will be shed off. Whereas here, you lose strands of hair all over the scalp. There is no particular area. Hair loss will be all over the scalp compared to androgenetic alopecia.
Okay. What group of people with COVID, are at risk for hair loss? Is this younger, older, male, female? Are there any risk factors?
Yeah, coming to the age and sex, what I have seen, middle to old age people are experiencing more of hair loss comparatively compared to the younger generation. Though younger generation also are experiencing, but more of 30, 40, 30 to 50 age group, I would like to put it. One. Coming to the male female preponderance, I see a slight female preponderance in this. Females experience more hair loss compared to the male fraternity.
Wow, that is
But I've seen, yeah, but I've seen young patients as young as 18 to 20 also experience hair loss. If you take the ratio, it's middle age group and females toward more hair loss.
Mhm. Well, I'm sure there are so many explanations for that, and because our general audience
Yeah,
is, our audience is general public, we don't want to go into too much of scientific details.
yeah.
But just keeping it
Okay.
simple, how long does it take for the hair to grow back once they lose it?
Yeah, it's a good question. Usually, like what we have seen, it takes anywhere between 6 to 9 months for the condition to return back to almost its normal position. Usually, like we have to give a lot of hair care supplements and uh, tablets, and there are a lot of things other, but it's not like instant other thing. Any skin condition or skin infection may subside within few weeks. But hair loss takes at least 6 months to 1 year. I can put it. This kind of hair loss it takes 6 months to 1 year.
Mm-hmm. Wow. So the everything is so scary because we were worried
Yeah.
of this being a problem with the lungs, but looks like it affected so many other organs. Now hair loss, and that too affecting females, younger age group, and taking for so many months to grow
Yeah.
back. This virus is
I
ridiculous.
think. Yeah, over a period of time, I think we will expect more of this hair loss condition. I think I would like to say more than 90% of COVID patients might experience, like, more studies are needed in this. Like, have to see what I am seeing. Like, more than 75% of COVID infected patients are experiencing tremendous hair loss. That's I'm doing a paper on it. Just I will share it later. Yeah.
Oh, very nice. So when should people see doctor? Once they
Yeah.
see hair loss, I'm sure it's a panicky state.
Yeah, it's a very good question. So, what kind of, when the hair loss is very much sudden loss of hair, then abundant, like while combing, usually they're losing certain amount of hair, like 20 to 30 hair strands per day is almost normal. But patient themselves know, more than 3 to 4 times their normal range, they start losing one. Then sudden losing of hair. Then third one, the hair loss associated with patchy baldness. In certain areas, you can see complete total loss of hair, what you call alopecia areata. That one. Then this loss associated with itching of scalp, then pain and redness. All this will pinpoint to an underlying some medical condition that needs to be treated. If it is there, then immediately they should consult a doctor. Sudden hair loss, severe hair loss associated with itching and pain. Then if there is alopecia areata kind of hair loss, like multiple patches, bald patches,
Mhm.
this,
Can
they should
you
consult first.
can you tell us some tips and remedies for this hair loss?
Yeah, hair loss, if you see, like, most of the, like, endorsement or advertisement what we see in our daily this thing, most of it is about hair care and skin care only. See what and all, starting from aloe vera to all. If you come to home remedies, like, you have many patients, they give their own experience with, like, onion juice, coconut oil commonly used, applied, jojoba oil, egg hair mask, egg mixing with olive oil and applying to scalp, then washing after 15 to 20 minutes. Many natural supplements patients will be trying with comparative good results. But what we as a dermatologist do is, in this case of hair loss, usually, as we know, keratin is the major component of hair. It's the structural protein. So it's made up of 18 amino acids, out of which 16 is a major amino acid. It's a sulfur-containing amino acids. Usually, we give these biotin supplements for them. Biotin, calcium pantothenate, and sulfur amino acid supplements, which works very well. It will prevent the hair loss within 1 to 2 weeks immediately. So, along with this, we add on to, minoxidil is like a gold standard. Minoxidil, it's usually in strength of 2% we use for females and 5% we use for males. So that can also be tried. But the main thing is that in this hair group, what I feel is it's a holistic approach, not just giving some prescription or tablets or lotion and all. For every hair loss patient, I make it mandatory to explain to them, like, whatever I give, 50% it will work. Another 50% is your diet, sleep, stress. All these things will come into role. Because one more thing, what we see is, like, lack of sleep. In this COVID, there's a lot of stress going on because a lot of uncertainty. Many people have lost their jobs. There are a lot of financial problems going on. This stress will add to that, and again will cause hair loss. One more thing. Then another thing, I have seen a lot of patients who are quarantined, though during COVID. experiencing hair loss later. The the word of being COVID positive is very much psychologically disturbing. We see, if you get to know COVID positive means patient will have 50% of his psychological thing, like getting depressed kind of thing. So I will take it as a like what we call a total, like it's psychological, social, physical, and mental, every aspect, like it's a holistic approach. I treat ALS patient, but only thing is that patients should be properly counseled. Whatever we give, it's not instant. Within 2 to 3 weeks we may not find the result. It takes at least 2 to 3 months to see any visible result. So, the home remedy, like as I told, aloe vera, onion juice, then coconut oil. Coconut oil is a very, like almost all of us have that. It contains fatty acids which will go inside the hair shaft, and it will lock the protein inside and give strength to the hair. Like eggs, jojoba oil, all this, fish, cod liver oil capsules, everything works. Only thing is that it takes time depending on the patient's this thing, body.
Very well said. So, if I get this right, so what you're saying is people should not continue natural supplements that you
Yeah,
just mentioned. Along with that, if
yeah,
needed, they can apply minoxidil, obviously after talking
yeah,
to a dermatologist, and that's 2% for
yeah,
females, 5% for men. And also, people should focus
yeah,
on good diet, sleep, stress relief,
yeah,
and then the hair will
yeah.
naturally grow back on its
The
own in a
meditation.
span of few months.
Yeah, yeah. One thing to tell, like to stress management strategies, especially in this pandemic, yoga and meditation is also a very important part of this regimen. Yeah,
Okay.
I tell most of my patients to do meditation and yoga.
Okay. All right. So that was great. So we're moving on to some of the skin problems that people have.
Yeah,
There is acne associated with the use of masks, uh,
yeah,
and there is other skin problems. So, in your experience, what are the skin problems that actually present with this pandemic, COVID-19?
yeah. In this pandemic, three things are in common, like wearing face mask, excessive use of sanitizers, and lockdown. These three things are common. Coming to face mask, we are getting abundant of acne in areas covered by face mask. That is like bridge of the nose, cheeks, and chin area. This is a new entity that is termed as maskne. That is mask-induced acne or mask-aggravated acne. This is on the rise now after this COVID pandemic. We are seeing a lot of patients with mask-aggravated acne. So this is the, you can see that inflammatory, that is reddish and pustular skin lesions on the cheek, right side of the cheek. Again, because of long standing use of this N95 mask, we call it N95 acne. It's a very common thing what we are seeing daily. uh, then apart from that,
So, looks like
yeah,
it can also happen in children, right?
yeah, this is mask tinea. It's a tinea, a fungal infection. You can see reddish erythematous elevated active borders with central clearing with intense itching. It's tinea faciei. That is the superficial fungal infection affecting the face. Again, it's a very common now fungal infection due to long usage of mask. Then apart from that, we, because of this prolonged use of sanitizers, soap, excessive use of this soap and water, we're seeing a lot of hand dermatitis, hand eczema. That is also very much common.
Okay.
So three, yeah,
When it
these
comes
three things.
Mhm.
Yeah,
When it comes to acne, there are so many myths with this. Can you tell us how to take care of this and what are the actual facts? As a so very
yeah,
experienced dermatologist.
yeah. Fine, because acne is like a bread and butter for any dermatologist. Like every third patient, what we see is a acne patient. Hmm? So there are a lot of myths. What we feel is, first thing is like only teenagers get acne. Like, it's a common feeling. But now the entity, what we call post-adolescent acne or adult acne, is very much common. What used to see acne in teenage people, now I see 25, 30, 35, 40 plus also. We call it adult acne, that one. Then coming to this, many home remedies patients will try, like lemon juice, garlic, and toothpaste. That will dry the pimple early. Many have tried also. They have tried with toothpaste with good results also. Colgate toothpaste for acne. Then many have tried this garlic applying on the acne. So many have ended up with causing black pigmentation on the face. So though they have these antibacterial properties, they can cause rash and irritation and peeling of skin and redness. Better to be avoided all these like self home care remedies. Then many people will think mainly it's because of impure blood. Acne is because of impure blood. So if you take a blood purifier like Safi kind of thing, your acne will clear. So acne is nothing to do with impure blood. Hmm? Then one more common notion is that a person will get acne if he has got bad bowel movements or constipation. So again, this is also a myth. Constipation is nothing to do with acne. If a patient has constipation, indirectly he may have stress also in that. That stress may increase acne, but constipation directly has no role on acne. Then commonly people will tell, doctor, I have a lot of heat in my body. My body got excess of heat, so I am getting acne. I don't know with what they measure the temperature they are relating to that. Usually, any infection, fever, or thyroid disorders can increase the body heat. It may cause prickly heat or miliaria, what we call, but it won't cause acne. Then, commonly coming to the food, this thing, oily and fried foods trigger acne. So, what I have seen, foods with high glycemic index and dairy products can trigger acne. Like oily foods and all, it won't affect much of acne. It's a controversial topic. We can discuss this for a longer period of time also.
Okay.
Then most of the people will think acne, we get it only on the face, but that's not true. Wherever there is sebaceous gland, we can get acne. That is the central chest, shoulder area, upper back. These are all the areas where there is abundance of sebaceous or oil producing glands. These are all the areas where you can get acne.
Hmm. And that's great.
Yeah.
How about popping pimples? What do you think of that?
Yeah. Yeah, popping the pimple, like that's what we call, it's a new entity, Picker's acne. Usually, young females, while watching TV or reading, they put their fingers on the pimple and pick it. It's a psychological tendency that to pick the acne, it will go faster. No matter it goes faster, but it leaves what we call post acne hyperpigmentation or post acne brown spot that will stay for a longer period of time. Many people will be having just spots on the face because of this regular popping the pimple has to be avoided because it can leave brown spots for a longer period of time.
Mhm.
Yeah.
Okay, great. I have to
Then,
remind my viewers, for some reason, the comments are not showing up for me. So if you have any questions, make sure to type the comments below in the comment section and we will get to it after the live session. So the biggest question is herpes zoster, right? So there have been some increased reports of herpes zoster after taking COVID vaccine, which is quite scary. So is there any association of herpes zoster with COVID vaccine?
yeah, it's a good question and a hot topic for discussion. Usually, this herpes zoster, it is due to reactivation of the latent varicella zoster virus. That is the virus which causes chickenpox in the young age group. The same virus in the old age group, after a person's immunity gets decreased, it will get reactivated and causes this herpes zoster. So, to surprisingly, I have seen three cases of herpes zoster after COVID vaccination in this in the past 1 month, the last 1 month. So, two patients had second doses of vaccine, and one patient after the first dose almost all of them had this reactivation after 5 to 10 days of that. That's quite it's a big number, three zoster cases. Then came back to search in the net, like not many cases have been reported about this. Like so, what I thought is COVID itself is like an immunosuppressive state. Like if you are infected with COVID, like a T lymphocyte count also will get reduced. Then apart from that, usually after vaccination, I think in the first 2 weeks there will be like decreased immunity. That probably might have. I think more research is needed into this, because we are yet to see like many case reports from other parts of the world. But I myself have seen three cases of reactivation of herpes zoster after COVID vaccination. Maybe the age group was around 40 to 48 years, middle age group only. That patient didn't add any other like immunocompromised status kind of thing. Only COVID vaccination was given. So more research is needed into this aspect. So it presents as like a grouped vesicular lesions or boils kind of thing on an erythematous base, that is reddish base. You can show me the photo. In
Yeah.
a dermatome, dermatome is in a segment, one side. Yeah, it is almost drying up. So it can occur on any part of the body, commonly at the chest, trunk area, or on the face. So it's a very painful condition, very painful condition, and it leaves what you call neuralgic pain, post-herpetic neuralgia. It may last for months together. So it should be treated early. Treated early, and then we treat early with antivirals like oral acyclovir, with topical calamine lotion, and antibacterials, with symptomatic like painkillers. So it should be treated early. I think more research is needed. We need to see many more cases arise like this.
So obviously, there is not a lot of experience with this. But so far, what you have seen, is this self limited and easily treated with the drugs you just mentioned?
Yeah, thing is that if you start early, like within 48 to 72 hours, the outcome will be better with this oral, what we have seen, acyclovir. So
Uh-huh.
longer the duration. One more thing, like in many of the rural parts of our country, what they do, they apply this Uttada Mannu, or what do you call that? Uh, Uttada Mannu. They apply the soil. They think like it's because of some gods, this thing, Sarpasuttu, we call it. Many people won't take treatment at all for this. So herpes zoster affecting the trigeminal, this and the face, it will leave trigeminal neuralgia lasting for months together. Many patients not treated properly will have this neuralgic pain, with like many of them will have sleeplessness, psychological depression, and suicidal tendencies also. We have seen patients of herpes zoster.
Okay.
So it's early the treatment better will be the response.
Okay. So the point I was trying to make is there have been very, very, very few cases of herpes zoster with after COVID vaccine. It is not possible to say COVID
Yeah,
vaccine caused this. So this does not mean you should not get the
yeah,
vaccine if you're eligible. So if you're eligible, go do get the vaccine. So that's the message, right?
yeah. That's very much true. That's very much true.
Yeah. So can you see eczema or an increased eczema with COVID? What has been your experience with that?
Yeah, doctor. Like of late, like sanitizers and like wearing PPE kit, especially you have to wear gown, then goggles, gloves, all these. So these have become part of our life. So all of this are causing like gloves are causing a lot of contact dermatitis. Repeated use of hand sanitizers. Hand sanitizers contain ethyl alcohol and isopropyl alcohol. So they will make your skin to get rid of the natural oils, essential oils, and make the skin dry. If you already have a dry, sensitive skin, then the effect will be more. It causes a severe form of hand eczema. Your hand becomes severely dry, red, erythematous, with itching, and in severe stages, it may crack and bleed also. seen a lot of hand dermatitis cases, like what you call it's chronic irritant contact dermatitis.
Mm-hmm.
So one more thing is that these hand sanitizers, which are rich in fragrances, they are loaded with toxic chemicals like parabens and phthalates,
Mm-hmm.
which can cause hormonal imbalance. Then one more thing is that this triclosan we have heard of. Triclosan, it's an antibacterial which is used in many soaps and all. So frequent use of this antibacterial soaps also, it's a cause for concern because it can promote antibacterial resistance. It's a big topic of discussion, like. So it's like those who have sensitive skin individuals, we have seen a lot of hand dermatitis cases and eczema, to be fair. Apart from that, those who are wearing mask also, those they are getting rashes on the areas where it comes in contact with the mask. Skin comes in contact with the mask. In that area, because of occlusion, we are getting
Mm-hmm.
folliculitis also. Apart from that, again, fungal infection are also rampant
Mm-hmm.
in this COVID.
Yeah, I'm showing a
Yeah,
picture of mask tinea.
yeah, yeah. You can see, like, yeah, tinea is it's a superficial fungal infection of skin caused by dermatophyte. Dermatophytes are the fungus that invade only the superficial layer of the skin, like skin, hair, and nails. It won't go deeper on the dermatophytes. So how it will look like, if you can show me the photograph, I'll just tell that tinea, commonly called as ringworm.
Mm-hmm.
Yeah, it will be like a erythematous peripheral border, like a reddish border. You can see an active border with the central clearing, and intense itching will be there. Ringworm, it's like a ring. It can be round or oval or polycyclic, so it can occur on any part of the body. Here you can see a rounded lesion with a peripheral active border and central clearing and mild scaling on the back of the trunk. On the right hand side, you can see tinea on the face, like on the forehead. You can see the only thing for tinea to find out, like common people, is that it will have an active border. Peripheral active border will be there, and intense itching will be there, mild scaling. So
Okay.
again, this is also very very common in this pandemic.
Yeah. So I have to remind our viewers these are all photos from real patients that Dr. Girish has seen in his clinical practice. And I have to thank Dr. Girish and the patients for actually letting us use these pictures to educate you all. And I also want to
It's
remind you, for some reason, the comments are not working. So if you have any questions, do post the comments below. So we will get to that after the live session.
yeah.
Uh, so we talked about all these problems with sanitizer and masks and other things. So what can be done to prevent this?
Yeah, it's a good question. Like, thing is that those who have already have a dry, sensitive skin, after like applying sanitizers and all, they have to use what do you call emollients or moisturizers. So immediately after washing their hands, apply moisturizer containing urea, glycerin, or whites of paraffin, aloe vera. Anything is fine. Immediately after wash, when the hand is in a semi-wet condition, apply the moisturizers liberally to these areas. Those already who have a lot of itchy, inflamed red skin, I think those patients need to use steroids, mild to moderate potent steroids, for a shorter period of time. Then along with that, coming to the, I think what we have seen is regular using of soap and water, that causes less of this dryness compared to this certain hand sanitizers. So whatever is the case, if you if you when you feel like your hands are getting dried and cracked up, immediately apply moisturizer. The common, like in the home, what you use is coconut oil. Coconut oil is best this thing to apply.
That's great
Yeah.
to know. And
Yeah,
any topic on hair and skin is not done unless we touch a bit on this fungal infections that has been increased during this time. So,
yeah,
what is the cause of these fungal infections? So, more specific, I have to ask this. If someone has an infection on their skin that is black in color, people are concerned that
yeah.
they can turn into black fungus. So, what do you want to say about that?
Yeah, it's a very, very good question because daily after the emergence of this black fungus or mucormycosis, many patients are of the concern like whatever fungus they have in like in the thigh area or abdominal area. Usually, either it will be reddish in color or blackish. They think that itself is a black fungus. Whether it will spread from the abdomen or thigh to the nose, many people are apprehensive about that. So one thing to make it clear is that whatever fungus is there on their skin, that is dermatophyte, it's a superficial fungal infection. It won't invade deeper. Whereas this black fungus is a deep fungal infection. It is seen in patients like post COVID recovered patient who have been hospitalized or who are on ventilator or ICU oxygen therapy for a longer period of time. After that, coming home, or those who are on steroids for a longer period of time. So we are seeing black fungus in those patients. This black fungus is it's a deeper fungal infection. There is nothing to do with what we have shown earlier. We say only it will affect only the skin. Even if you take that fungus and keep it inside your nose, also it won't infect you.
Hmm.
Deep fungus is an opportunistic infection. It's an opportunistic. Only those who have uncontrolled diabetes to the tune of 400 to 500, those who are on oxygen therapy, ICU, or on ventilator for a longer period of time. After coming back from that, we are seeing those patients. They have to be cautious of this early signs. Like I think in the earlier videos it have been explained, like pain or swelling on one side of the face with excruciating pain. These are signs of the nothing to do with skin fungus. We do receive a lot of calls like their fungal infection spreading to the nose. It won't happen at all. Even if you take your skin fungus and take it and put it inside your nose, it won't infect. That's it.
Okay,
That's it.
that's very reassuring. I think a
Fine.
lot of people have access to pharmacy. They go buy whatever they want
Yeah,
from pharmacy. There have been a lot of
yeah, yeah,
increase in the use of steroids on the face. So
yeah,
can you
yeah,
tell me a little
yeah.
bit about why people are using steroids on their face even without talking to a doctor, and what are the problems with that?
Yeah, it's a very, very good question. Now the thing is that everyone wants to have a like fair skin, huh? Fair skin. So for that, tempted by their relatives or friends, it's their tendency strong steroid. I don't want to mention the name of the brand and all, betamethasone or clobetasol. These are all strong steroids, potent steroids.
Mm-hmm.
If you apply on the face, within 1 week or 10 days, your face will start glowing, will get a glow on a face. So 1 month, 2 month, they start continuing, they get very much glow. So after that, all the steroid related side effects starts, what we call thinning of skin, redness, acne form eruption or pimple kind of thing, then telangiectasia, thin blood vessels on the face. Then all these things will start after 2 to 3 months. So it may take a little bit more time or less time depending on individual skin. Now the thing is that many of the educated patients we have seen using this strong steroid creams on the face, like a fairness cream, because we don't have a proper control over the use of this. No, they can take from the pharmacy, they can go and take any cream they want. In most of the pharmacy they will ask for the cream. It may cost around 30 to 50 rupees. Then they start applying, they will get glow within 1 week, so that's assuring for them. So they start continuing that over a period. We have seen many patients using the steroid creams on the face for years together. So outskirts of Bangalore, if you go, almost every alternate or one in third home will have this steroid cream. I don't want to mention the name. They'll
Mm-hmm.
be using like NS cream. So despite many awareness campaigns from our IADVL, like Indian Association of Dermatologists, Venerologists, and Leprologists, So to a certain extent, we have brought this under control. So let's because they are using this potent steroid and antifungal combination also. So if they use that immediately, for time being, itching will reduce, rashes will also reduce, but tinea will not go. So it will what we call tinea incognito or steroid modified tinea. It's a new entity. So these are all are the causes for recurrence. One more thing, what patient are doing is they apply for 10 days or 2 weeks, they get symptomatic relief, they stop it abruptly. Again, after 1 to 2 weeks, the tinea will recover because that fungal element will be there in the villus air. So we have made a new this thing for that rule of two. Rule of two, in the sense how to use this antifungal therapy. Antifungal creams should be used 2 times daily, 2 centimeters away from the margin of the lesion. If you have this much only on the like a coin shaped area, don't apply only into that area. 2 centimeters away from the edges of the lesion, then 2 centimeters after clinical resolution. That is, even if you get symptomatic relief from the itching and there is a disappearance of the lesion, you continue for 2 more weeks. So that we call rule of two. This, if we follow, so to a certain extent, we can prevent recurrences of fungal infection.
Hmm.
Rule of two is in the,
Hmm.
yeah. Don't do self medication. That's one of the important thing. Otherwise, you have a lot of hundreds of creams. Patient will think like one particular cream. It's like a, what do you call sarvarogakku ide maddu andange. They will think that's the only cream will solve everything. If you apply a steroid cream for any infection or any this thing, immediately the symptoms will reduce, but it won't take away the source of infection, but it will go on spreading.
Hmm.
It should be like properly educated
Okay. So
patients to be.
steroid abuse can be a huge problem. So I can say,
Yeah, yeah,
with interacting with so many people in my real life, both in India and outside India, one of the
yeah,
best ways to prevent yourself from tanning is actually used to use a sunscreen. So use a good
yeah,
brand sunscreen which actually has a good sun protective factor, a good SPF, and you can
yeah,
prevent tanning.
yeah. Broad spectrum sunscreen, broad spectrum covering all this. Yeah,
Yeah, so I do have to be very respectful of your time because you are a very busy person. So
no,
obviously, during COVID, everybody is sitting online. People are spending a lot of time. This has been a very frequent
yeah,
question, and there has
yeah,
been issues with blue light. So, what type of questions do you get from your patients about these blue light, and what do you tell them about what to do about this?
yeah. It's a very important question pertaining in this pandemic. Most of the time, like most of the lockdown, like most of our software professionals are working from their home, so they are exposed to this light emitted from laptop. So this emits a blue light. This blue light is a high energy visible light in a 380 to 500 nanometer. So the indoor sources of blue light is laptop, mobile, all these are all indoor sources of blue light. So they will be exposed to this light around 8 to 12 hours per day daily, this blue light. So what I am seeing is like a increase in the incidence of this melasma, what you call mask of pregnancy previously, melasma, the blackish pigmentation on the cheeks. You can see that. And this periorbital melanosis or under eye dark circles. These two are on the rise. If you go on thinking about it, so the main cause is this blue light. This causes degradation of collagen and elastin fibers that gives structural integrity to the skin. This causes wrinkling of the skin and premature aging, blue light. Apart from that, it will also stimulate the melanocytes, blue light, and causes increased pigmentation. That's why those who had lighter melasma will gradually develop a darker melasma. Then one more thing, we have seen a lot of patients using mobiles for a longer period of time before going to bed and all. This blue light inhibits the melatonin production. Melatonin is the hormone that is responsible for good night's sleep. So when this hormone is deprived, there is disturbance in the sleep cycle, then patient will have insomnia. There is a lot of sleep disturbances, what you call biological clock or circadian rhythm, so that gets altered. So apart from that, he gets this under eye dark circles, all these things. So this melasma, under eye dark circles, and I think much research is needed into this for a longer period of time. Like it may cause premature aging, wrinkling, all this. But it's too early to comment on that. But definitely increase in the incidence of this hyperpigmentary disorders like melasma and periorbital melanosis. I have seen with blue light,
Hmm.
like exposure to blue light because of these electronic gadgets.
Okay. Okay.
So, uh,
Great. No, this was very helpful, Girish. Thank you so much for taking your time.
yeah,
So I do want to
yeah,
uh,
yeah.
thank our patients again. Yeah, go ahead.
One thing how to avoid this blue light related skin side effects is to reduce the screen time as far as possible. If possible, use a screen protector, and as you told, using sunscreen inside your home. A physical sunscreen like titanium zinc oxide and titanium dioxide that will physically block the blue rays. One. Then I will advise most of my patients 30 minutes to 1 hour before going to bed, don't use your mobiles. So many of the who had this sleep disturbances and all, if they follow this, like there'll be a very good improvement in their sleep, because when they use mobile during night time, that is one of the important cause for this sleep disturbances. Then take a digital break as far as possible. This will, over a period of time, gradually improve all the side effects related to them.
Okay, great. Thank you
Any
so much.
questions?
And
Thank
this
you.
is Dr. Girish, who is very active in on TV channels and social media and everywhere. So he's a well-known personality. So I have to remind you all to post questions in the comments below. So unfortunately, I couldn't take any live comments in this session. So I have to thank you all for hanging in. And if you're a returning viewer, make sure you also hit the like and share button. And Girish, is there any last word you want to say before we hang up?
Yeah, it's first of all, I want to thank you for giving me this opportunity to meet after a long gap of 2 decades. So it's refreshing. Then I hope like I think everything is fine on your side. Hope the third wave will not be that much severe as what we experienced this when it will go pass off easily. So everyone will have a the same world what we had 1.5 year back.
I know.
Yeah, this 1.5 year have been very much distressing and what do you call very much psychologically disturbing.
Yeah.
As a doctor, we have seen, we have also seen. So
Yeah.
hope it passes off faster
And
that
hope
way.
we can meet in person soon. So, this
Yeah,
craziness
yeah,
will
that's
go
right.
away. And,
Definitely.
we want everybody to stay happy and healthy. And
Yeah,
don't fall for fake news. So make sure you
yeah,
get the right content so you don't harm yourself doing things that you're not supposed to be doing. Right.
yeah, definitely.
All right, Girish. Thank you so much. And,
Thank you.
enjoy. Take care. Bye.
Thank you. Thank you. Pleasure. Pleasure. Thank you.